My name is Omondi Okello. I am the sister to patient Daniel Omondi Okello, who was diagnosed with sickle cell in 2010 after 4 years of living with it. And from 2010 until 2018, we've been managing his condition from home until it got to a point that we had to seek a lasting solution so that maybe the crisis that he was having might come to an end. So at some point during the years in between, we got in touch with Livonta Healthcare Solutions, and they helped us produce documents and all the necessary things or requirements, fulfill all the necessary requirements that were required to help us look for more of a lasting solution to his condition. So with the help of the Livonta, we were able to process our documents with the Ministry of Health from our country, and also the government, and also our insurance, national NHIF, In November 2018, we came to India for the first time, coming to seek treatment for Daniel, and I accompanied him. And the first reception was very good from the hospital side. At least we had someone pick us from the airport. It's our first time in India and you don't know what to expect on the other side. I think that was a very good move for the hospital for coming to pick up from the airport. And on our first consultation with our doctor, our consulting doctor, Dr. Dharma, I think he explained everything well, all that was needed for his condition, for his treatment, and we drew a treatment plan for him, and everything was done to the latter. And as at now, as we speak, Daniel is doing well. He has really improved, and I think this has been the best experience in my life, having been his caretaker, having been there for him, having been his hope on this other side of the world, because now our family is in our country back home. I think it has been the best experience for BLK. I really appreciate your help. I really appreciate your services. You have very good services. The international team has been very cooperative, very helpful in whatever situations that we have been, whether in normal conditions or an emergency. They have always been there and provided solutions for whatever we might be needing at that moment. And also for Dr. Dharma, we want to say a very big thank you, because I don't know, without the BMT, maybe not, his life maybe have shortened by now, and he will not be able to enjoy so many services, or the things that he may be wanting to enjoy, he will not have enjoyed them. Dr. Dharma has been of help. He has always been there when you need him. He has always explained everything that you need to know at what time of the treatment, at what point of the treatment, pre-transplant, transplant, and now post-transplant. He has been really of great help, and I think he deserves the best, because up to this point, we have not experienced any challenges, and whenever he's called upon, he would respond, and I'm really grateful for him. For the BMT team, I think that's the best team, because they are always there. They're first to respond. In an emergency case, they will be there with you until your patient gets well, until you're good to go. The nurses are great. They're kind, they're loving, they're fun to be with, and they are greatly attached to their patients. And I think that is of great essence, especially with healing and recovery. That is a very good step. And I like the idea of the BMT patients having their own rooms and having their own staff, their own nurses, their own doctors. That is very good. I like the idea of the ward rounds, the whole team coming for the rounds. It's really exciting to see the whole team there, and they will discuss something and also involve you in the decision making. And yeah, it has been a very nice experience here in India and also in BLK. I would recommend anyone outside there who would want to come for any health related issues to come to BLK, because the services are good. From the management to the services, everything is just perfect.
BLK Super Speciality Hospital, a passion for healing.